right, looks like we are live. Hello, everybody. My name is Erik Cardenas, and I'm co-founder and CEO at a Latino-focused startup called Zócalo Health. I'm going to be the moderator today, and it is my great pleasure to welcome a fantastic panel of entrepreneurs that have a long track record of making digital health a bit more equitable. Cristina, Mario, Abner, thank you for taking time out of your busy schedules to speak with us today. I'm really looking forward to the discussion and getting your take on how we can advance health equity through innovation. I'm going to give you all an opportunity to introduce yourselves here in a few minutes. But before we dive in, I do want to highlight that this is a 60-minute session. And while I have a whole bunch of questions lined up, I do want to encourage the audience to get involved and submit questions. And I'll do my best to incorporate those into the discussion. So to kick things off, I do want to we'll start with introductions, and we'll go around the table. We'll start with Cristina, Mario, and then Abner. And really just share with the audience a little bit more about yourself, about your company, and really emphasize your why. Let's start with you, Cristina.
Thank you, Erik. I am really excited to share with you all today alongside these great panelists. So my name is Cristina Leos. I am a public health researcher. I'm a behavioral scientist, and I'm also founder of a tech nonprofit that supports adolescent health and reducing health disparities among teens across the country. And we do this work primarily through our mobile app called Real Talk, where we crowdsource stories from young people on topics like sexual health, mental health, identity, and many more, and help connect them with information, resources, and support to help them lead healthy lives. And it's my greatest passion. I absolutely love what I do. I love working with young people. And for me, it is based on my experience growing up on the US-Mexico border, where I felt like I didn't have the support that I needed to really make the best decisions for my life. And I can see that now, kind of being on the other side of it as an adult and realizing like, wow, things could have gone so differently, or I really wanted to have more support. So in my career as a public health researcher, I have had the great privilege of being able to innovate in this area and try and find better solutions. Working with tons of young people from across the country, we co-developed this idea for Real Talk, which is really grounded in youth stories, focused on the topics that they care about most, and helping to connect them with all the wonderful resources that exist. Or if they don't exist, helping to develop the resources that can better support young people. So I have lots more to say, and I'm excited to dig into this conversation with everyone.
Awesome. Thank you so much, Cristina. Go ahead, Mario.
Well, my name is Mario Anglada. Thank you for the time this afternoon to participate in such a distinguished panel. And what I'd like to share is that we created OI Health, and my background specifically, I've done over 25 years of traditional healthcare marketing and sales at companies like Procter & Gamble, Johnson & Johnson, Nestle, and always saw an opportunity to support the Hispanic community with solutions that address their needs from a cultural and linguistic perspective. And in all those roles and in all those opportunities, I always thought that, wow, there's a great opportunity here that nobody's tapped into. So over the course of my career, I decided that I was going to test that out and ended up, prior to OI Health, working at Univision, the Hispanic media company, where I led a team that developed healthcare products for underserved communities across the U.S. We had products like telemedicine, medication discount cards, and others. And when I saw the acceptance that those particular type of products had within the Hispanic community, I said, well, it's time to take a leap and actually develop something to solve the opportunity that I had seen constantly throughout my career. So founded OI Health, which is a health tech platform that provides primary care and provides primary care at a third grade education level. It does it with traditional stakeholders. So we work with institutional partners like hospitals, clinics, insurance companies, and the like. But we made it in a way where actually all our products and services could be paid for by the consumer themselves if they did not have health insurance. And we did that on purpose because we wanted to really make sure that access was no longer one of the reasons why a lot of the Hispanic community suffers from healthcare inequities. So this panel and this opportunity to speak about this particular topic I think it's really prescient. As we've seen during the pandemic, this has become an ongoing and very highlighted issue within the Hispanic community as a whole. So I'm happy to participate and looking forward to the discussion today.
Thanks so much, Mario. Abner?
Sure. Thanks. It's great to be here and to join three really great entrepreneurs. So thanks for having me. My name is Abner Mason. I'm founder and CEO of a company called Consejo Sano. We are now, it's interesting. We were doing health equity before it became such a common thing now. But now I say, and to be honest, I didn't really think of it initially as really being a health equity company. I was trying to solve a problem, which was our healthcare system in the U.S. Hasn't kept up with the demographic changes, and especially in the way that the healthcare stakeholders engage with patients and health plan members. The country's become much more multicultural. California today, where we are, is a majority minority state. The whole country's on the path to becoming majority minority by according to the census, by say 2040 or so. Yet the healthcare system still engages with people much like it did in the 70s, a sort of one size fits all approach. Usually it's engagement content created by English speakers for English speakers. They might translate it, usually not well. But that approach, which is really a sort of a one size fits all approach, I just found in my own life and the life of my family, it just doesn't work. It doesn't build trust. If you treat everyone the same, what you're really saying is the thing that makes us unique, our life journey, our experience with the healthcare system, our trust for the healthcare system, our willingness or ability to engage in healthcare, how the social determinants of health uniquely affect us. You're saying all those things don't matter. And, Eric, you and I get treated the same. And Cristina, if we're in a health plan too often, other than, recognizing you're a woman and I'm a man, otherwise we're treated the exact same. And yet we're completely different. And so what I thought is that if we could figure out how to treat people like who they are matters, really understanding who they are at a deeper level and use data to do that so that we could do it at scale, I thought we would have a company that could really make a difference and drive better health outcomes, especially for underserved and low income and multicultural and other communities that just struggle to connect with healthcare. It turns out I was doing health equity work because really what we're trying to do is to help our health system in the U.S. engage with people in a way that can build trust and that so the healthcare system can work for everybody, regardless of what they look like, what they talk like, where they come from, or how much money they make. So we are we started on this path. We built a technology platform that allows us to ingest a lot of data. Public data, private data, claims data. We've added to that a team that understands how different communities across the country consume healthcare. It allows us to create, and we're on a path here, we're building technology to do this, to create really an N of one experience. And what we mean by N of one, that is to engage with every person in a unique way based on who they are. And what we're finding as we do that more and more, and we build the better and better technology to do that, we can build trust and we can navigate people into healthcare at the right time in the right place. So that's what we're doing. It's a journey, and I'm just honored to be with Mario and Cristina and you, Eric, because I know you're on similar journeys. I really am optimistic that people like us can really move the dial and improve our healthcare system so it really does work for everyone.
Yeah, and I think I speak for the others. Like, I think this is where, and I think Mario, you as well, Cristina, you've all been doing this for a while, and I think we're definitely sort of paving the way for others. And I hope that we start to really see more entrepreneurs, more people wanting to take the leap into this, because there are a lot of tailwinds right now, and hopefully we can continue to build momentum there to address the needs of our communities. You brought up a really important topic, Abner, around one size fits all healthcare and services. Cristina, I was looking through your website, and there was a quote there that really resonated with me that touches on this, which was that you felt that real stories, real teenagers can be more effective in helping than articles made by adults who haven't lived the experience. Talk to us a little bit about that. I mean, obviously there's a big theme here with one size fits all really doesn't serve all. Talk to us a little bit about that and how you're addressing that.
Yeah, definitely. That is one of my favorite quotes. I mean, that's why it's on our website, of course. So this was actually shared by one of the teenagers who uses our app. And, you know, one of the things that we have learned, and this gap that Real Talk is really helping to fill, is that so many experiences we have, especially when it comes to health issues, mental health issues, identity struggles. I mean, I'm sure everyone can remember what it's like to be a teenager and growing up and all the changes you're experiencing. So many of those experiences throughout the life course, are extremely isolating. It feels like, when you don't see yourself reflected in the media, when you don't see yourself supported in the healthcare system, when you don't see yourself thriving in so many of these different spaces, it's isolating. It can feel like there is no one there who understands you, who can help you, who can really be by your side as you're going through it. So through Real Talk, our theory of change is to bring together people's experiences, to bring their voices, their actual lived experiences onto our platform for others to see and understand that you are not alone. And, you might be a Black, Latinx, queer person in Iowa, and there's someone else who understands your identities, your experiences, and something, it's not exactly the same, but there's someone who can relate to your experience and can support you through that. So that, for us, storytelling and bringing together people's voices is absolutely core to everything that we do. And, what better way to really understand what needs need to be addressed, what strength and resilience looks like in different communities, and how we can amplify those. Like, there's just such a wealth of information and possibility that we can get from people's stories.
Yeah, no, that's great. That's powerful. I guess going back to this, Abner, in your situation, looking at what Consejo Sano does today, I think, we're also talking about innovation and finding ways to leverage technology. So just like Christina's using her platform to share stories with people that can relate, talk to us about the importance of engagement and why something as simple as text messaging and being able to communicate with content that makes sense, right? That it isn't intended for this audience can really have an impact.
Sure. So thanks for that question. So what we have found as we have worked with our clients, and our clients are typically health plans, mostly Medicaid today. So we work with Medicaid managed care plans, but increasingly our business is growing with Medicare Advantage and with Exchange. So those three lines of business, but our biggest footprint is in Medicaid. And Medicaid, as you know, is a program for low-income people. So these are folks who, in addition to being low-income, they frequently are impacted by the social determinants of health. It is a population that is very multicultural. In California, I think the percentage of people in the Medicaid program that are multicultural is like 81%. Texas is 79%. Florida is in the mid 60s. So and if you round it out with New York and Illinois, the five big states with the biggest Medicaid populations, it's an overwhelmingly multicultural population. So low income, multicultural, low health literacy, frequently, low levels of trust for the health system, speaking a multitude of languages as their first language. This is a hard group to engage. And so what we found is that if you take the approach that they're all the same, and we're just going to send them the same message, we might translate it, you are not going to build trust, and you're not going to engage that population. So what we've said is that, why don't we turn that old approach on its head and instead really put the member first? So I'm going to just talk about Medicaid members, for example, because it's the largest health program in the country. We ought to put the member first. So we ought to communicate with him in the language they prefer. We should recognize that language is not the most important thing. So for instance, just because you speak Spanish, all Spanish speakers aren't the same. Culturally, we found that, in some cases, we found this out the hard way. If you treat folks from Puerto Rico the exact same as from Mexico and assume because they speak Spanish, they have the same experience and the same approach to healthcare, shame on us, right? So, because that's not wise. But that's the way healthcare works too often. So, and in addition, you've got to communicate with them in the way they prefer. So we have a healthcare system that historically has sent mail. And a lot of us still get it from your health plan. America in 2022 does not communicate through mail. That's not how we communicate, especially low income, underserved, multicultural people. They're much more comfortable with text messaging. So we ought to say, you know what? Let's stop trying to engage with people in a way that they do not wish to engage and won't engage. And instead, let's prioritize the way they want to engage. And so texting is an example of that. So that's what we're trying to do. It's kind of putting the member or the patient first, saying that if given the choice between asking people to be different than who they are, asking the healthcare consumer to change who they are in order to get healthcare, that's one side. The other side is healthcare should change and connect and treat that person like their healthcare consumer and meet their needs. We feel that it makes more sense for us to do the latter. We've got to stop expecting people to change who they are in order to access healthcare. And instead, we've got to build a healthcare system that's nimble, that much like the rest of the economy. And that's why I love what Mario is doing and his background, because he comes from that world where they treat the consumer like the consumer is important. That, companies don't say to people, you need to change who you are to buy my products, but they build products that people like and want to use. And so that's what we're trying to do at Consejo Sano. I laugh, but it really is core to us having a healthcare system that works, that builds trust, that engages people. I'll give you one quick example and then I'll stop. We've been doing a lot of work trying to get vaccine hesitant people to get the vaccination. So we've got one health plan client. It's a big client and it's a big Medicaid population. They gave us, about half their members to engage. These are folks who had not been vaccinated by, say, April or May. So this is after the vaccines were widely available. So this is a hesitant, these folks don't want to get the vaccine. So they gave us about half their members and they engaged the other half. The half they engaged, that 50%, about 8% of their folks got the vaccine. But the half that we engaged, we were able so far, and this number is going up, to get 24% to get a vaccine in their arm. That's a 300% increase. And the only difference really is that we said, let's understand who people are. Let's engage with them based on who they are. Let's understand what their concerns are from a cultural perspective and language and income and all the other issues and build a relationship with them. And what we are proving is that if you take the time to do that, you can get better results. You can get people to engage in their healthcare. So I could go on, but I'll stop there. The key here is that doing things the same old way isn't going to improve anything. All the problems we have are going to stay with us if we keep doing things the same old way. We've got to try different approaches, and that's what Cristina and that's what Mario are doing. That's what we're trying to do. That's what you're trying to do, Erik. So I think we just need more of it. We're not enough.
Yeah, definitely.
I agree, and I applaud. First thing that you learn as a marketer is segmentation is key, right? You have to understand who you're talking to in order to be able to talk to them effectively. And what you're saying is absolutely right, Abner. The dynamic is, how do you get into a commonality of communication points? And that's where I think technology is a great equalizer. The Latino community as a whole over indexes on technology. So your comments on text messaging and other forms of digital communication is absolutely right. At OI Health, what we start to do is we start from a base of third grade education level, right? Because we want to make sure that you're able to get a message and you're able to get a message that is very simple to understand. If you want to make that discussion one more robust and one more educated, we can guide you through that process. But if you are content with following instructions and having somebody guide you through a healthcare journey, which is what our company does, is we take you by the hand, we gave you tools. You have a cell phone, great. If you don't have one, we'll provide you one. And now you have a connectivity and a data point to feed in and pull out information from where that consumer can engage every single day. So we've been able to do this because we understand that you have to go to create the basis of the communication. We communicate via text with our members. About 85% of them, that's the preferred methodology. And once we get them, we've been able to show results like 72% glycemic control within 90 days in really vulnerable populations in the mountains of Puerto Rico where cell phone access is an issue, right? So what you're doing, and I agree wholeheartedly with your premise that you have to tailor the dynamic. The difference between a Puerto Rican and a Mexican, I know by heart. I'm from Puerto Rico and my wife is from Mexico. And when we got married, we both speak Spanish, and I quickly learned that that's not true. So understanding the nuances is critically important. What we do is we try to match on age, sex, language, and ethnicity. So if I'm a monolingual Spanish-speaking Puerto Rican male with hypertension, my coach or the one who guides me through my journey has to have that similar profile. And we've seen that at that level of engagement, you're absolutely right. Trust is the first thing. You tell a Puerto Rican, stop eating tortillas, and they're going to smile and never engage with you because we never started eating tortillas. And on the flip side, tell a Mexican that, and guess what? The diet is going to stop. It's going to stop in that call. So there's cultural nuances that have to be taken into consideration. And it's not for a lack of trying. I have to be honest in saying, hey, the healthcare system has tried many, many times. What I think is different, and we're representing here in the panel, is the Latino community has actually decided, hey, we're going to do it for ourselves. And I think now with the advent of having tools that can be easily deployed, technology that's readily available. If I FaceTime with my grandmother in Puerto Rico, why can't I FaceTime with my physician who understands me? Those types of dynamics are what ultimately are going to get consumers engaged. And it's not a matter of when it happens, it's actually happening today. Our challenge, I think, as entrepreneurs within the space is to magnify our voices and show the incredible good work that's being done and how that can be replicated and escalated. So I'm 100% in agreement with Abner and his comments around the engagement for the Latino community and the level of engagement that's needed. But there's ways of doing it. Hey, we've done a bunch of other things in this world. I think access of healthcare for a vulnerable population within a subset of a community is something easily achievable if we put our minds to it.
Yeah, that's great. Thank you for that, Abner and Mario. I think one of the themes here that I think really resonates that we've talked about is access. You just mentioned Mario, tech being a big equalizer. And Cristina, you even mentioned how your platform is sort of shrinking the world, connecting someone with a very specific identity in Iowa with someone who might be in California. Access is huge. Technology plays a big role. I'll tee this up for the panel. Whoever wants to jump on this is, when it comes to this access, what's some of the wins that you've seen, some of the things that have been effective from a technology perspective, and just share with the audience maybe how you gauge whether these things are working, because I think what a lot of people don't recognize that as an entrepreneur, as a startup, there's a lot of iteration, like experiment, trial and error. How are you working on this access? How are you leveraging technology to really extend your reach? What's working, what's not? Anything that you can share there?
I could start. At Oi Health, what we do is we understand that the population that we reach might have access to technology, but if you have a data constricted cell phone, you are going to think very, very hard. What am I using this data for? Because I use this data as a communication data point, right? I'm connecting with family members in country of origin. I'm doing education for my kids. There's a whole host of different dynamics that need to happen. So what we decided at Oi Health to do about it was to partner with the big tech companies. We have a partnership with Verizon Wireless, where we're deploying our solutions to these consumers in an unlimited capacity, right? Because if constraint is a data point, let's take that data point out of the equation, and then let's see how we can best deploy solutions once they're there. The second element that's really important is you have to create, when you're building big tools, you have to think about who is this going to go? And when, at least in our perspective at Oi Health, we focus on primary care. That could be anybody from 18 plus to our oldest patient today on our platform is 98 years old. So equalizing the experience across a broad base of consumers is really, really important. And that's where it's been the iterative process that you mentioned, Erik. You have to continue to refine to get down something to a point where with our system and our remote patient monitoring solution, all you do is one tap. That's all that's needed from you. And if you're able to tap, that means that somebody who has visual acuity issues because of age probably has a bigger font, but once they tap, the system works, and it creates a really cohesive engagement engine, which is important, right? The first step is getting you to do something. If you get that person to do one thing and you get them to repeat action, what we've seen at least, and our partner clients have seen as well, is that the consumers really starts snowballing from there, because now they feel empowered, heard, they have visibility, and they know that in the worst case scenario, all I have to do is hit that call button and somebody's going to answer 24 hours, 7 days a week. That level of simplicity is really hard, but you can look at models that are already working and emulate a lot of these. So one of the things that healthcare entrepreneurs really quickly learn is that you really need to know healthcare before you can start disrupting it, right? And Abner's work is commendable because he started the journey a lot earlier than many of others in the space. Looking at what others are doing and replicating that for your particular subset of clients is really critical. So a lot of the iteration that we work on is using best practices and fine-tuning those over the course of the development arch in order to continuously improve with the one goal, which is engagement. If you can't get engagement, everything else is a pretty mobile app that nobody will ever use, right? And at least that's been our experience.
Yeah, that's great. I think that gives me a couple of things here that I want to unpack. You know, I think when we talk about some of the challenges that we all face when trying to build for this community, I think one in particular, maybe this one's more for you, Cristina, is around just some of the stigma that exists within our community. How big of a challenge has that been? And how do you feel like you're able to tackle, especially when it comes to mental health and some of the things that are really sticky topics within our community?
Yeah, I love this question because my answer, I think, will illustrate a big difference between adults and young people, which is, it's one of my favorite things to talk about because I think I love kind of peeling back the veil a little bit on how exactly how different it is to really build a tool for young people versus what it would be like to build for adults. So you bring up this point of stigma, which is very real, you know, permeates all of society, but it's kind of concentrated in different ways among different communities. And they're actually, that's not an issue we've had with the young people themselves. And I think some of that is a generational shift because, you know, Gen Z is really progressive and really they're advocates. But I think there's also a bit of just, again, like adults kind of not really being in touch, maybe not remembering what it's like to be a young person. And I'll just share one example to also illustrate this. In the early days of Real Talk, we already knew that stories were the way to connect with young people. We'd gotten this positive feedback. We had successful prototypes. So we knew that stories were going to be the way that we deliver content and engage young people. And then we tried writing stories. So, you know, we're all health professionals, educators. We know the best practices. We're writing stories that we think young people would like. And when we shared them with teens, they very quickly said, this is not who wrote this? This is not a real story that a young person went through. You know, we wouldn't talk like this. We wouldn't do this. We wouldn't do that. So we knew, okay, we can't write the stories ourselves. What are we going to do? You know, can we even convince young people to write their stories? Would they be willing to share personal stories with us? Would they be willing to share on a platform where they don't know who's going to read it? As it turns out, they will. From the very first test that we ran all the way up to scaling it to the platform we have today, young people overwhelmingly are looking for an outlet to share, to be vulnerable, to build a community with other people. Like that has just, we see the challenges related to stigma around mental health, sexual health, identity with the outside world. But when they come together and they've kind of made that commitment to share and be vulnerable, it just doesn't exist anymore on our platform. I mean, I'd like to say it's a big statement, but we just really haven't seen that be as much of a barrier as I think we initially thought it would.
Great. Are there other like surprises that you've come across? If stigma hasn't really been a barrier, what are some barriers that you've observed with this generation that maybe some of us older folks might not have picked up on Anything you can share there? Any lessons learned?
Yeah, I mean, the main one is really that we don't know what it's like to be a young person, and we don't know. I'm not old. I don't think I'm old, but I certainly am not a teenager, and I'm reminded of that every single day. Kind of every new thing that we're working on, I'm reminded that there is a difference there. So I think really sometimes we as adults, teachers, parents, educators, whatever, we get in our own way, wanting to control young people, wanting to impose our views on them. And we're seeing that currently. I mean, honestly, we're seeing that right now with going back to school and young people organizing, protesting, and walking out because they know what is best for them. They know how to keep themselves safe. And if we support them in that, we will probably be surprised by the answer because I'm not sure that we have all the answers for them. So I won't say too much on that, but that's my response there.
Yeah, definitely giving them room. Yeah, absolutely. What about you, Abner? In terms of just some of the challenges that you've seen, share with us just lessons learned, right? Are there any key learnings as going on your startup journey, right, from beginning to end, taking us from 0 to 1 to where you are now? Any
Sure.
major challenges that you can share with us?
Sure. So I'll share two quick ones. The one is a sort of a lesson that I learned that I want to share with others, especially folks who are listening who may be considering becoming entrepreneurs. And I hope that you will be inspired by Erik and Mario and Cristina, and what we're trying to do. So I'm hoping, because we need better solutions. Our healthcare system is failing. It doesn't work well. We spend a ton of money in the US, but it does not provide great outcomes, and it needs better solutions. And I believe that some of those solutions are going to have to come from people who come from a much more diverse background. Too often, I used to go to JP Morgan before it got canceled or went virtual because of COVID. And I remember, I think it was 2018, walking into the lobby of one of the main hotels there in San Francisco and seeing just literally hundreds and hundreds and hundreds of people in the lobby. They were there for the conference and everybody's having side meetings. But as I looked closely, I realized, yes, it was hundreds of people in the lobby, but it was like 99% white men. And what's funny is they all were wearing the same things, a blue jacket and a white shirt, no tie. I mean, it was like there's a uniform. And I had my sister with me. She came with me. It was the first time she had gone to JP Morgan. And I remember she said to me, as we were walking in, she's like, how do you work in an industry like this? This is terrible. That it's so unrepresentative of the country that our healthcare system is supposed to serve. And I say that not because I'm against anybody who's a white male. In fact, we need everybody's good ideas. But the problem is we haven't been getting everybody's good ideas, and we need to change that. So I'm really hoping that this panel inspires people who are listening to throw their hat in the ring. If you've got an idea, if you don't like what you're seeing in healthcare, and I can't imagine that you love what you're seeing. If you don't like what you're seeing, we need you. We need new ideas. We need people who are bringing different experiences and see things through different lenses, because that's how we're going to get, innovation that is not innovation just to have something new, but innovation that brings in solutions that can actually improve healthcare. So two quick things. One, when I first had the idea for Consejo Sano, we were going to be more of a telehealth solution. I had met a large telehealth provider in Mexico. They had an incredible, high quality solution, and I wanted to build an app that would connect Spanish speakers in the U.S. to native Spanish speaking doctors in Mexico. I thought it was a great idea. This was in 2013 or so. And so I was able to get some companies to use it for their employees, because they were trying to improve the employee experience for their Latino or Hispanic employees. But I really wanted to get into the healthcare space. And so I remember going and talking to a CEO of a large federally qualified health center. It's a huge FQHC. This is where a safety net provider in Southern California. I remember sitting across from his desk and he said to me, Abner, I love what you've built. This is incredible. It would be great because my patients, probably 60% prefer Spanish, and we really struggle with them. I'd love this. And you could connect, my patients could connect to a doctor, not to replace me, but to supplement me. It would be great. And I would love to use it. But he said, I can't. And I remember being just like, I think the blood rushed out of my face. And he said, because the way I get paid is the patients have to come into my clinic. And your solution, while it's beautiful and I love it, it will keep patients from coming into my clinic. So I would love to use it. It's a better solution. It makes more sense for the patient and for taxpayers. It has all these benefits, but I can't use it because you'll put me out of business. And there was like silence. And so he then said, but the way you're reaching out to people to get them to use this service, that I can use, because if you can reach out to people in this customized, treating them more like who they are matters, and instead of getting them to call a doctor in Mexico, get them into my clinic, then that'll help me, that we can do business. And we actually changed our model, and that led to us being the company we are today. So I actually owe him a debt of gratitude for that, because he helped us change the model. But what it taught me was, in healthcare, you really have to know how the money flows. No matter how good your idea is, it does not matter if you don't figure out how to make that idea work with the healthcare system, which is illogical. It's not a market. Our healthcare, it's not a market. It's not any kind of normal market. It doesn't behave like a market. All the incentives are misaligned in healthcare in the US. And so you got to figure out, as an entrepreneur, how do you build your solution so that you can make it work in an environment that's a crazy, upside down, illogical environment. So that's my one piece of advice. And then I'll quickly, in terms of a big challenge that we face, and this also connects to how our healthcare system just isn't working well. As much as we've talked about the fact that text messaging is how people communicate, how they want to communicate, how they prefer to communicate, and in most instances, the only way they'll communicate, most health plans in the U.S. are still constrained and find it difficult to use text messaging as opposed to U.S. mail. They can mail all day long, but they can't text message because of old law. There's an old federal law called the Telephone Consumer Protection Act. So that we need to take a look at laws and regulations, and we need to see them through a lens of 2022 common sense, and we need to see them through a lens of health equity. And it's something we need to do soon. And if we do that, what we're going to find is there's a whole lot of regulations in healthcare and laws that need to be changed. If we're willing to see those things through that lens of what makes sense for today, and also what makes sense from a health equity perspective. Because texting is an example. It's a huge problem for us. This is how silly it is. We can text today to get people to get a vaccine in their arm, COVID vaccine, because of the national emergency. It means that law is waived. But as soon as the emergency is over, I can't text that same member to say, come in for a breast cancer screening. So I mean, to think about it, I can text them today to say, come in to get a COVID vaccine. But as soon as the emergency is over, I can't text them to say, come in for a breast cancer screening. It's crazy, and we need to change it. That's
great. I do want to give Mario a chance to share some of the challenges, but what you did say there, Abner, is something that resonates with me quite a bit. In that, your JPM story, I grew up inner city Houston. I grew up with not the best access to healthcare and education, and there's a lot of code switching that goes on, right? Like, I think I've happened to manage the code switching to my advantage. I've made it. I got to work at Amazon, big company, and definitely felt alone, right, with just the low number of people that looked like me. And I think this is where there's a ton of opportunity. This is where, for the first time in a long time, being as an entrepreneur here for a while, that we are in a position where we can start to really solve our own problems. And I think that the advantage there is tremendous, that we need to be the ones that have our shared and lived experiences and use those to fuel the innovation that our communities so desperately need. So that does resonate with me quite a bit. So I just want to thank you for bringing that up. It's hard. It's hard to sometimes assimilate, and especially for some people who are first generation as well, right? Like we are, you're not Mexican enough, you're not American enough, you have to straddle two cultures, and that is absolutely difficult. And definitely I want the audience to know that like there are people who want to do good, and I encourage anyone who's interested in trying to do more to definitely connect with people. There's plenty of also folks like us who like to talk to people about ideas and mentor and things like that. So that's definitely something that did resonate with me. But Mario, let me give you an opportunity. Why don't you share with us a little bit about some of the challenges that you've seen? Abner covered basically a successful pivot, in my opinion. Anything you can share with us?
Well, similar story. So when we started OI Health, we decided that we were going to provide an end-to-end solution in primary care, right? The doctor, the medications, the chronic condition management. What we really quickly realized was that we had a tool that would enable us to be a force multiplier. And all we had to do was to pivot it slightly and make it available to healthcare professionals, the federally qualified health centers, the health insurance companies, and the like. And all of a sudden, the ecosystem that we had built that was end-to-end could be deployed by a doctor's office to a patient's home, with our team helping that connectivity point, back to the connection comment that was made a while ago. So taking that slight modification to our ecosystem allowed us quickly then to embed ourselves. And one of the challenges that everybody in healthcare goes through, and I can say that because it's a common phrase, it's called death by pilot, right? You're going to go and you're going to work with big institutions, and think about it, they're trusting you not to kill people. So they're going to really make sure you know what you're doing. That being said, you have to create and you have to have enough of a team experience within the healthcare system to know how to actually structure a pilot, how to measure the right things, how to be able to transpose those small results into a journey that is scalable. Once you're able to do that and you prove it once, then what quickly occurs, Erik, is an exercise in how much more can we do together? How fast can you move it? Are you sure that we can deploy all this really, really quickly? I need it in 2 weeks. So it goes from a slow, boom, let's go really quickly. Second thing that's important for us, and this is something that I think we could all agree on, the pandemic has brought a lot of negativity to many of us, but it also has changed quite dramatically the healthcare landscape from a tech perspective, right? Because if you can't move, then all of a sudden extenders into the community become incredibly important. So I think that those are opportunities that are still being mapped out, as Abner mentioned, and I hope it does not happen. When the emergency is over, a lot of the restrictions that were lifted from a telemedicine and a connectivity standpoint are being identified as potentially going back to as they were. I think that is an incredible mistake, because we've seen the ability to actually engage with vulnerability in locations where historically you couldn't have a good healthcare system working. And now we have glimpses and opportunities and pilots and demonstration projects that actually show that if you are careful in what you do and you do it incrementally, you're not going to change everything from day 1 to day 100, but going through a journey and a cycle, we're able to start seeing change. So the opportunity and the challenge for us, at least, has been the pandemic. But I think that it's actually shown that, and I don't say it myself, our partners, we work with the Mayo Clinic, they told us, listen, we did a pivot from hospitals to the home, and our results were incredible. Patients have better outcomes at home because they feel more empowered, because their families are taking care of them, because you're not in a hospital setting, you're actually in your bed in your home. But there has to be that telemetry. There has to be somebody to being able to connect you to understand if something starts going wrong, what do we do about it? And that's a lot of the hesitancy that the healthcare system has, right? They're like, well, what happens if at 2 a.m. in the morning, a drop in blood pressure happens and you don't see it? Well, that's our job to see that. So our pivot, to answer your question directly, was to understand that taking out friction for current stakeholders was the easiest path to adoption for us. Instead of having to go and remodel how we were doing it, we said, let's work with the partners, let's figure out what the problem is, but let's take our starting point, which is it has to be for everybody. It has to be a third grade education level. We started out in 2 languages. We're at 19 today. And there's a continuous build that goes through it, but understanding how the money flows and why the no is given is important. Once you get the no, then you can solve for that no quite easily.
Yeah, that's great. That's great call outs there, Mario. Just doing a quick time check. We've got a little less than 15 minutes. What I want to do with the remainder of this time, I want us to think about the future, right? We have witnessed here in the last few months what the pandemic has done to accelerate the dialogue in this country around health equity and really serving underrepresented communities and things like that. What do you all see as opportunities? And I really want to take this conversation more into the direction of how you think, like opportunities that we can share with the audience. Like maybe it's something that may not be completely related to you. You could talk about your company, where you want to go, what problems you want to solve. But what does the landscape look like to you? From an insider's perspective, what are these opportunities that we should be talking about and that you expect should be things that we should focus on here going into the future? You want to start us off, Cristina?
It's a great question. It's a big question. I think I need a minute to think, like, what are some trends here? Because just as everyone has said, there's so much that has changed in the last 2 years and beyond. So I'll think about that for a minute.
Yeah, definitely. Take your time. I don't know, Abner or Mario, if one of you want to.
I'll jump in, Eric. Mention what I think is a great opportunity, at least for OI Health. What we're seeing right now, and I'm here in Guadalajara, Mexico, launching everything we do in the States down in Mexico, because where we think the future lives is in transnational care. So think about the Mexican diaspora, 45 million Mexican Americans in the US. They take care of a lot of people in Mexico as a product of remittances. There's about $41 billion that flow into Mexico. And a lot of that is healthcare related. So when we engage with our consumers and we see their socioeconomic backgrounds, we know that they are going to be at pause sometimes of being able to take care of themselves because they have to take care of family in country of origin. So what we're planning to do in the next couple of years is to actually link those consumers in the US and their family members back in Mexico to provide care that is efficient for both US consumers and Mexico consumers, and help them save money in the process, allowing that hard-earned dollar that is earned in the US at a lot of personal sacrifice and costs many times, to be able to utilize those opportunities of helping loved ones in country of origin. And we're seeing that Puerto Rico historically didn't have those challenges as other countries in Latin America, but because of a whole host of issues, we're starting to see the same dynamic in Puerto Rico. And I think that starting to visualize the problems of healthcare globally from the perspective of, hey, everybody needs to see a doctor. Once you get a condition, it's either episodic or chronic. The basic building blocks are the same for healthcare in a primary care setting, regardless of where you're at. So what we're actively working on is being able to connect those transnational links to support family members, because if you are coming from Mexico and you're supporting people in Mexico, we think healthcare doesn't need to have boundaries. It has to be able to empower consumers to support themselves wherever they might live. That could be inner city New York, that could be the mountains of Puerto Rico, or that could be anywhere in Mexico or Central America, which is where I think that a lot of innovation is happening. LATAM is an incredible incubator of ideas because you have socioeconomic pressures that when you look at those pressures and you are able to see what they've done, then you can take some of those ideas and transpose them to richer markets like the US. So that's where we're seeing a lot of potential development opportunities into the future.
That's great. Thank you for that, Mario. Or Cristina?
I really appreciate Mario's comments, and I think priority really should be policy change so that we can take what we've learned. But in the last couple of years, because of the pandemic and also because of the sort of national discussion around racial equity and racial justice and health equity that took place that really started with the murder of George Floyd. The combination of those two things, that national discussion, and then the disparate impact of COVID, and people, even people who didn't want to see, were forced to see and acknowledge that the impact of COVID was different for different communities because of the historic sort of the racism and biases and unequal opportunities that existed and that exist in communities across the country. COVID kind of was an opportunity for people to see that, because you could see the disparate impact. So the combination of these two things has created this moment in time for us as a country, I think, where there is an opportunity for us to really have some policy change. So a few that I would specifically, point to, and I'm picking things, I'm going to be very practical here. I hate to be political, but this is the world we live in. I think it's likely that we're going to have some change in the Congress. And so I'm talking about things now that the administration can do over the because we have an administration today, President Biden and his team, they believe in health equity. They've got some of the best health equity people in the country on the team. I think, unfortunately, they've not been able to do all the things they want to do on health equity because they've been fighting the COVID fire. When the house is burning, you have to put out the fire, and then you can start to figure out how to rearrange the house. And so our healthcare house needs to be rearranged, but they had to put out the fire first, and the fire isn't, as you know, quite out. So I'm not criticizing them, but I am saying that we got the clock is ticking because we won't be able to do much in these areas with the Congress, I suspect, after the new Congress comes in, because I think one or both houses will likely switch. But the things I'm talking about don't need the Congress. So specifically, this texting is the health equity issue in healthcare. And we have got to figure out a way to deal with the fact that plans can't engage, health plans, particularly Medicaid, but all plans can't engage with their members in the way the members prefer. So we got to fix that. That's a policy issue. And I'm not saying change the law, because getting the Congress to change the law is almost impossible. But there are things that can be done administratively that can address that. So texting is one. We need to collect race, ethnicity, and language data. These are administrative. These things can be done administratively. We've been talking about collecting RAIL data, they call it race, ethnicity, and language, because if we know disparities exist. COVID showed us disparities exist, but we knew it before COVID, right? But unless we have metrics around it, unless we can say this population has, using breast cancer as an example, there are these disparities between breast cancer, between Latino women and Black women and white women, then even within Latino populations, between different cultures. We need to be able to measure so that we can then design programs to address them. So my second point, we've been talking about collecting real data forever. Let's just make it a requirement and collect it, this race, ethnicity, and language data. Third, that'll give us the opportunity to then do something I think would really be helpful in terms of moving health equity forward. We should tie quality measures and Medicaid and Medicare Advantage to reducing disparities. Once we can measure disparities, then you ought not have a 4-star Medicare Advantage plan if your membership has dramatic disparities, particularly if there are racial-based disparities or income-based disparities. And we could even, I'm not saying punish plans, but you could reward them for closing these disparities. So tie quality measures in Medicaid for HEDIS and in Medicare Advantage, the star rating programs, to reducing quality measures. And then fourth, and I'll stop here, we need to invest in the social determinants of health. I was on a panel the other day with Sachin Jain, and he said, stop calling it that, call it poverty. We need to invest in social determinants of health is a nice phrase, but it really is about being poor. And so we're never going to get the health outcomes we want if we don't invest in those upstream issues. If people don't have any food, forget about controlling their A1C and their diabetes, right? So I think there's opportunities out there. The Medicare Advantage program has introduced a new program called supplemental benefits. It allows the Medicare Advantage program to spend some of the premium dollar on upstream issues, like buying an air conditioner for a senior in South Texas in July. When it keeps her from having a respiratory event that's going to cost tens of thousands. It costs, $1,000 to put in an air conditioner. So that's what I mean by a practical solution. That's a great program. The supplemental benefits program in Medicare Advantage but why can't we have the same flexibility in Medicaid, where most of the low-income people are? And we shouldn't make the Medicaid programs in the states have to turn, do all sorts of crazy stuff in order to do what we're letting Medicare Advantage plans do today. So those are just 4 examples of policy changes that could be done mostly administratively. And we ought to do them before this current administration is over. In my view, the clock is ticking.
Yeah, thank you. Great points there. Cristina, I know we're almost at time. I want to give you an opportunity here to jump in.
Yeah, thank you. I, wanted to pull a couple of threads that both Abner and Mario had said, and some of the stuff we said previously. Before the pandemic even began, there was already this growth, this massive growth in technology companies built for social impact. They want to be addressing social harm. They want to be addressing social determinants of health. They want to be really innovating in these areas, just as we have all said, that these social pains that exist. And then the pandemic pressure tested that, right? We can't unsee all the cracks and all the holes and all the gaps. And so I am looking forward to seeing more and more people really come forward with some ideas, identify innovative solutions, reconsider, maybe they weren't working in this area before, but now they have some new inspiration or motivation to contribute something more into this kind of tech, health equity, innovation space. And I think there will be just more and more and more of that, including folks who are attending this panel.
Great. Well, thank you very much. I know we're pretty much at time. I think we covered a lot of great topics today. I think that for me, the key takeaways have really been that, technology is really shrinking the world and is playing a key role. I think that our unique backgrounds, our lived and shared experiences are really valuable when it comes to innovating in this space. Policy, I think, is going to play a big role. And I think what I'd like to tell the audience here today is I tweeted this yesterday that complaining is contagious, but so is inspiration, right? And I think that what we need to do is we need to really embrace community. What Daniel's doing with SaludConTech, with the Latino Coalition Against COVID-19, we need to really continue to organize and unify our voices, because this is where we're going to truly drive change. And so I want to thank all of you today for all of the amazing work that you're doing. Really want to encourage the audience to follow you all on social, on Twitter, on LinkedIn. Reach out to these folks if you are inspired by what they're doing. I'm pretty sure all of us are looking to either hire or connect with people who have ideas. And so please do engage, build community. And again, I want to thank you all, Cristina, Mario, Abner, thank you so much. I wish you continued success and good luck as we enter the rest of 2022.
I'd like to thank everybody. It's been an honor.